We believe Lisa is suffering from environment-related despair.
Oh, it's even worse when you know it has a name.
Now, don't worry. She'll be fine after years of expensive treatment. And we have a new drug to combat this syndrome. Ignoritol. Let me show you how Ignoritol works. It turns this to this. Huh?
Lisa's a little young to be taking happy pills.
Marge, we came to an appointment in the middle of the day. That's the most a parent can do.
What is going on YouTube? I am the Mental Corner and welcome back for another mental health discussion on my channel. Because today marks the last day of my medication, I figured it would be kind of an appropriate time to make a video about antidepressants and kind of use this video to help people with questions of their own, such as should I take them and can these actually cure my depression? You know, kind of questions that I myself were asking doctors and other people as I was kind of introduced to this solution. So let's dive right into it. So how did this whole discovery of antidepressants start? Well, a long time ago, somewhere in the 19th century, depressed and anxious patients were actually sent to restful places or asylums. And here they used tactics such as psychoanalysis and psychotherapy, but no real medicinal treatment was used. While there was no medicinal treatment used, in some instances they used chemically induced convulsive therapy to kind of induce large seizures 2 to 3 times a week for these patients, which caused them to experience, brutal injuries such as broken bones and muscle damage. It wasn't until 1951 when a doctor by the name of Roland Kuhn discovered that imipramine, which is a drug originally used for psychosis, was not very effective. And this discovery kind of led to another discovery of tricyclic antidepressants, and eventually in 1987, selective serotonin reuptake inhibitors, or SSRIs for short, were introduced to the market, and they were almost instantly popular because they were a much safer method than other previous tactics used. So what are antidepressants? So basically, the majority of medication for mental health disorders kind of falls into 4 categories. We have anti-anxiety drugs, antidepressants, antipsychotics, and mood stabilizers. For this talk, I'm going to be focusing more on antidepressants, just because, there is so much information about each of the 4 that it would just be way more effective to just focus on the one that I personally have experienced. So what are these little pills that we'll be discussing, and why are people using them? Well, basically, worldwide there is an estimate rate of mental disorders in adults ranging from 12.2% all the way to 48.6%. The World Health Organization estimates that there's around 450 million individuals that suffer worldwide from neuropsychiatric disorders in their lifetime. Antidepressants were fabricated to kind of target this issue. By increasing the ability of the molecules in our brain to deal with our emotions, motivations, and memory, antidepressants help the many of us that suffer from mental disorders and mood disorders. Antidepressants are more commonly used to treat depression, but they can also be used to treat, pain, anxiety, and insomnia. There are different types of antidepressants that are used throughout medicine, with the most popular being the ones that we have mentioned, SSRIs. This is the type that we'll be more focused on. But there are also 3 other major types of medication used for mental health besides SSRIs. There are the serotonin noradrenaline reuptake inhibitors, SNRIs. There are the tricyclic antidepressants, TCAs. And there are the monoamine oxidase inhibitors, MAOIs. SNRIs are similar to SSRIs as they are also used to treat depression. TCAs can treat depression, OCD, and bipolar disorder, and can typically take up to 2 to 4 weeks to fully work. MAOIs are older antidepressants that are not really prescribed as much due to their potential increase in side effects compared to the other types. Doctors should monitor you if you take these, and there are certain foods that you also cannot eat if you take them as well. There are a couple different reasons why someone would take antidepressants. For some, drugs are a short-term solution used to get over an immediate crisis, and then for others, drugs are an ongoing long-term treatment that gives them the ability to live with severe mental health problems. So antidepressants treat depression by increasing levels of serotonin, which is a neurotransmitter that carries signals between our neurons and our brain. Additionally, it blocks the reabsorption of serotonin into neurons, which makes more serotonin available to improve the transmission of messages between our neurons. These drugs have been developed to act on the enhancement of monoamine neurotransmission, and to target the neurobiological processes, kind of in hopes of finding rapid-acting antidepressant agents. They typically work within 2 to 3 weeks, but obviously, it varies from everyone. As many of you know, there's obviously a huge stigma surrounding medications such as antidepressants. Additionally, there seems to be a huge divide between whether or not antidepressants should be used because of their many side effects and potential ineffectiveness. On one end, you have the people who view antidepressants as a negative thing, so we'll get into that first. So the majority of side effects found in antidepressants go away after the first few weeks of treatment. However, some may continue well after that. This is because people react differently with different kinds of antidepressants. In the case of SSRIs, one may be intolerable, while another one may be just tolerable for you, as they differ in both their potency and in how quickly your body can metabolize the specific drug. Some of the side effects that are experienced when using SSRIs include nausea, vomiting, headache, drowsiness, dry mouth, insomnia, nervousness, dizziness, sexual problems, and impact on appetite, whether that be weight loss or weight gain. Additionally, stopping your medication early, while SSRIs aren't addictive, they can cause you to experience this thing called discontinuation syndrome, or in simpler terms, withdrawal-like symptoms, which is why doctors recommend that you ease out of medication once they've confirmed that you're recovered. So talking to your doctor is definitely required when taking antidepressants. The use of antidepressants can also be affected if you take other sorts of medications such as ibuprofen and anesthetics. It's also recommended by most doctors that alcohol should absolutely not be consumed in large quantities, if at all, when antidepressants are being used, as they can cause extreme drowsiness, dizziness, and coordination problems when they're mixed together. With all these side effects considered, it seems pretty clear why some people are incredibly against the use of drugs. A professor in Denmark by the name of Peter Gauthier claims that over 500,000 people over the age of 65 die due to psychiatric drug use every year in the Western world. He also claims that deaths from suicide in clinical trials are underreported, and that there is a spontaneous remission of depression over time when antidepressants are used. In his own words, and I quote, "The short-term relief seems to be replaced by long-term harms. Animal studies strongly suggest that these drugs can produce brain damage, which is probably the case for all psychotropic drugs. Given their lack of benefit, I estimate we could stop almost all psychotropic drugs without causing harm by only using a fraction of the antipsychotics and benzodiazepines we are currently using and dropping all antidepressants, ADHD drugs, and dementia drugs." Now, there are many people who would agree with the thoughts of Professor Gauthier, in the sense that antidepressants only harm the body and produce brain damage. The use of them actually does way more harm than good, and the stopping of using them could actually lead to a healthier population. However, this frame of mind is also incredibly countered by those who view antidepressants as a positive thing. Professor Gauthier's views were countered in 2015 at the BMJ discussion at London's King's College by a professor of mood disorders known as Alan Young and a psychiatric patient and a Guardian writer known as John Crace, who claimed that the research evidence showed that drugs do in fact work and are equally beneficial and effective as medication for other complex conditions. They even went as far to say that they are almost badly needed, as psychiatric conditions are the 5th leading cause of disability worldwide. Additionally, another professor of pharmacology known as Jorge H. Ramirez claimed that Gauthier's statements are extraordinary and that there's no supplementary raw data disclosed by him, which ultimately makes his claims irrelevant. Furthermore, research conducted shows that medications like antidepressants improve overall functioning and can actually protect brain cells from damage that illnesses such as schizophrenia and bipolar disorder cause. To kind of sum all that up, like anything else, antidepressants have both a negative and a positive side. In some cases, people respond better to some antidepressant medication than to others. In other cases, where antidepressants may not be needed due to the level of severity of one's mental health, the use of these medications can actually be counterproductive and cause more harm than anything else. Founding chairman of the foundation called Mental Health Excellence, known as Virgil Stucker, often reports that the experiences that he witnesses meet both ends of this spectrum. On one end, many people are harmed by meds, and on the other end, medication has saved the lives of many people. In his own words, there is no one size that fits all, and it often takes time and patience to discover what will work best for any given person. Antidepressants can be extremely helpful for clear-cut psychiatric disorders, but they have been reported as doing more harm than good when used for everyday difficulties that life throws at us. A situation known as irrational polypharmacy, which is when a prescribed dose of medication is too high or too low, and when new drugs are added when old ones aren't working, also causes increased side effects in patients. In the words of Virgil Stucker, people with short-term stress-induced psychiatric problems often do well with short-term medication, and sometimes with no medication at all if intense support is available. Whereas people with long-term severe psychiatric problems usually require long-term medication along with social support, decent housing, vocational rehabilitation, and psychotherapy. So where do I fall into all of this? Obviously at first I was very hesitant to use medication. When I was first trying to go out and seek help, medication was actually the first thing suggested to me before therapy or anything else. That was kind of the first thing the doctor told me. She was like, get on meds. And this immediate recommendation kind of made me feel like I was crazy. Like, why would she recommend medication before therapy or even, self-care techniques? Like, why was that the go-to? Was I that bad? And I guess I had always originally thought, because of the stigma, that medication was only used for crazy people. I never took into account just how many people actually use medication to get through their everyday lives. So it wasn't until things got really bad that I finally decided to go on them. And when I did go on them, my therapist kind of informed me that medication really is only 20% of the recovery process. The other 80% is therapy, self-love, meditation, peer support, whatever, like all of those things. It's a huge misconception for a lot of people that once you get on medication, all your problems will be solved. There's way more hard work involved than that. So the first one that was prescribed to me was originally an antipsychotic. Let me tell you, it was by far the worst experience of my life, or one of them. Like, it was up there. I forgot the name of the drug, which I know, come on, like seriously, you didn't even look it up before you took it, but I forget the name, but I would experience no emotion whatsoever the day after I took it. Like, it was like an immediate effect. I essentially was living day to day without any sort of reaction towards anything. My friends also commented on how, I looked incredibly unhealthy during this time. And additionally, the medication caused my heart rate to skyrocket. Now, being on the varsity swim team, that's not a great thing. During swim practices, I would need to stop and get out of the pool because my heart just couldn't slow down. And it felt like it would stop and crash at any point. It's hard to really put into words how scary that experience was, because like I would wake up and I would have no emotion towards anything. Like, anything could happen that day and I would not react to it. Like, my brain felt like it was flatlined. There was just like this continuous ringing in my head, like just one constant noise, and that was it. There were no thoughts. So that was really uncomfortable and not a great experience for me. And that's kind of when I realized, like, this is not working. Like, I gotta get off this right now. So I told my doctor, and we got me on another drug, which was called apoacetylopram. I said that wrong. Apoacetylopram, which is an antidepressant, which is the one I'm on right now. It worked way better, and I noticed that my heart rate got back to normal. And additionally, I was starting to feel more like myself and realized that this medication was working way better for me. And it actually enabled me to, do my everyday life, and it was able to help me with the recovery process. This experience kind of made me realize that, it's incredibly important to research what you're putting in your body as opposed to just taking it, because that's what I did at first. And it's also important to realize that it's never guaranteed that the first medication you're on will work for you the first time. And it's also incredibly important to keep talking to your doctor about what's going on, because if I hadn't, mentioned to my doctor the things that were going on, who knows what would have happened. So kind of wrapping up this whole video for you guys in some final thoughts. There's an incredible stigma surrounding the use of medication for mental health. Is it necessary? Does it cure depression? I'm obviously not a professional, so I can't say for sure, and I can't suggest anything. What I can say is that medication is only one step of the process. Therapy, self-love, peer support, among other things, are all part of this recovery process. Depending on medication, in most cases, is just not realistic. There are numerous negative outlooks on medication, and there are many people against the usage. But the positive sides are also there and kind of show us that, in most instances, medication has been incredibly useful in most people's recovery processes. It's not as scary as some people think. In conclusion, however, you are ultimately the person in charge of what you use and what you put in your body. Medication is not the only solution for a lot of us, but it is a solution. Taking the time to research different medications and discussing options with your family and doctors goes a long way. I know it definitely helped with me. And on that note, this is a long time coming, let me tell you. I'll see you guys next week.